Good day, everyone. I am Buensuceso, and together with my teammates Isabella de Guzman and Kim Fajardo, we are going to discuss about the two-variable scenario of our project entitled Quezon City 2050. Before we proceed to the four scenarios, let us first take a look at the current state of health in Quezon City. According to Quezon City health officials, the most common diseases in the city include pneumonia, food poisoning, gastroenteritis, dengue fever, and leptospirosis, while the leading causes of death are stroke, heart disease, cancer, diabetes, and chronic respiratory diseases. Quezon City also addresses the mental health issues of the community, such as depression, anxiety disorder, and emotional disorders. Dr. Verdades Dinga, the City Health Officer of Quezon City, disclosed that the problem in treating patients with mental illnesses in hospitals is the lack of continued care. Moreover, there is also a problem in making the mental health services accessible, affordable, and equitable to the constituents. As regard to the current COVID situation of Quezon City, they have put up 83 vaccination areas in 6 districts, which aims to vaccinate the individuals and administer booster shots for eligible recipients. These newly set up sites include 36 regular vaccination sites, 21 special or pop-up sites, and 16 malls or establishments. House-to-house vaccination for bedridden citizens is also offered by the city government. Here are the current initiatives regarding the healthcare system of Quezon City local government unit. First is the Hope facilities. There are 11 Hope facilities to care for COVID diagnosed citizens, both asymptomatic and mild symptoms. Each Hope facility has its own clinic, pharmacy, and supply room. Next is the PhilHealth card. The local government of QC will be distributing PhilHealth cards to its indigent residents. They have set a target of 50,000 families as beneficiaries of the PhilHealth benefit. Under the program, the city government will be paying for the contribution of these selected beneficiaries. This is to help its resident allay fears and worries when getting sick. And then lastly are the health centers. The QC government has added new health centers across the city and has renovated existing ones to be able to provide better health services to its Q citizens.
Hi everyone. So these are the four future scenarios we could think of regarding our topic, a healthier QC, modernized, digitized, preventive, and personalized healthcare. So there are four quadrants, four future scenarios, and let's discuss them one by one. So let's talk about what would happen if the city executes good governance. However, universities do not collaborate or co-innovate with the LGU. We call this quadrant as the one where nothing changes. It's basically just the status quo. There would still be free basic health care. Health centers would still exist. There would still be PWD discount card. There would also still be free vaccination against polio and flu. So nothing has changed. Whatever health initiatives we have right now in 2022, it will just carry on until 2050. No innovations at all. But what would happen if the city fails to execute good governance and at the same time there is no collaboration between the LGU and universities? So this is like the worst case scenario. Hence why we call this quadrant as the one where everybody dies. There would be higher mortality rate. People are just dying. More mental health issues as well because there are no health initiatives that could address mental health problems. Treatments would be expensive and outdated. And we say outdated because um, there would be no new medical treatments because the universities are not collaborating with the LGU. And predictably, inflation will get higher and people would have less purchasing power and less people could afford medical treatment. There will also be proliferation of communicable and non-communicable diseases because again, new diseases arise, but there are no new health interventions. And well, this is the scenario where the one where everybody dies.
For the third quadrant, our created scenario is entitled The One Where Ideas Will Remain Ideas. This scenario is created with the premise that there is co-innovation with universities in the city and the LGU, but there is also a failure of implementing good governance. With that, we perceive that we would be able to develop good quality healthcare within the city, but it would not be accessible to most, which result in greater inequality when it comes to healthcare. Furthermore, we also think that there would be a lot of medical theories that will be developed, but there would be lesser application of these theories, rendering them more or less useless to the public. Lastly, we also think that without good governance, there will be no new government health projects addressing health issues within the city because of lack of funding. So for the last quadrant, our created scenario is entitled The One Where Everyone Thrives. This scenario is the best case scenario wherein there is co-innovation between universities and the LGU, and there is also a successful implementation of good governance within the city. With this, our group perceives that by year 2050, there is already a cure for cancer. There would be higher funding for the health sector and for medical researches, which aids in creating a quality, free, and accessible healthcare system for all. Lastly, there would be a lower mortality rate in the city, and that's are due to old age because of the excellent medical care, medicines, and medical treatments available to the citizens of QC. That concludes our two variable scenario exercise for the city of Quezon City. Thank you for listening.